Good afternoon. It's Tuesday, February the 4th, 2021. Segel, David Lahashu Juts, and welcome to today's COVID-19 Task Force update on this, our 174th show. Today our guests will include Wahsontiio Montour, Program Manager of the Kahnawake Youth Centre, Christine Taylor, Prevention Worker, Promotion and Education from KSCS, Don Montour-Lazare of the KMHC, and Lloyd Phillips, Commissioner of Public Safety. We're going to start off our show right now with Wahsontiio from the Youth Centre.
I'm Wahsontiio, like I said. I am the program manager at the KYC, and I'm here to talk to you about the Winter Carnival 2021. And we are bringing the winter fun to the community in this pandemic as best as we could to host events in public and virtually. We partnered up with KSCS, KSDPP, reel them in to host challenges, events that you don't actually have to leave your house either during this winter carnival, that you could get all these events on our social media pages, our website, to have fun with it at home. So we have theme days during our winter carnival. Sorry, I'm really nervous. I'm just gonna backtrack. Our winter carnival is completely different from years past. Normally we're hosting events, all events in-house, in public, with spectators' participants, sorry. And this year, we had to change it. We've been brainstorming since October of last year already to how do we get the community to have some winter fun. You know, people are isolating themselves. They're all staying within their bubbles, their family, and this year, we're hosting these different events where you don't have to leave your home, but you can if you want. So our big one is a lighted skate trail, and Mother Nature is not cooperating at the moment. So bear with us, and we are out there for the last few days to water it, try to get it maintained. We're gonna get the lights out there, and as soon as we do, we are definitely gonna be notifying the community, like I said, on all of our social media pages, our website, probably the radio and such. And it's gonna be just something different. Just a new experience for some of these kids who've never been on the water in front of Onage skating this year. So we're hoping that it will bring just a new experience for everybody. We have theme days, like I said. Shout out to all the different community organizations in the community who are participating. So we had some from the MCK on Twin Day, and we had Step by Step in their best plaid. and these are just fun activities to do from your home. They're posting on our social media. They're using our hashtag, so don't forget this. It's KYC Winter Carnival 2021. You post it to your pages, and we'll see it. So like I said, the skate path, it's going to be, once Mother Nature allows us to get out there and weather permitted, we're going to be hosting it for the entire month of February now, just because we're delayed in it, and just to keep the outdoor fun going. This year, we changed, like I said, we changed so many different things, and our big fundraising event is the Polar Plunge. So this year, we're calling it Bring Home the Polar Plunge, and we want people to nominate their friends, families, co-workers to get out there and jump in the snow, do some snow angels. It's also our fundraiser, so send it to our we have an e-transfer information, so it's info@kahnawakeyouthcenter.ca. We're looking for everyone to have pledges out there. I nominate Christine Taylor. to get out there and bring the polar plunge home. We would like to see that video coming up. So yeah, we are trying our hardest to get the winter fun to everyone in the community. It is a unique situation we're in, and we hope to see everyone's posts, have fun with it. Yama.
Yawa Wahsontiio. I also probably going to nominate Christine Taylor for the Polar Plunge. And with that, here's Christine Taylor, who will be participating in the Polar Plunge, right, Christine?
And after like many years of doing it, yes, I will get in the spirit and do the Winter Carnival Polar Plunge. Yeah, we're looking forward to that. But that's all part of what I want to talk about today. Like I said, my name is Christine Taylor. I'm a prevention worker in promotion education at KSCS. And I've been tasked to talk about mental health and mental health during these pandemic times. As you know, these are highly stressful times. And I also want to mention that I am a certified instructor for both mental health first aid for adults that interact with youth, as well as a suicide intervention skills training assist that we offer through KSCS. I'm a certified trainer in both. I'm not an expert. I'm not a professional even. What I would like to say is that it's mostly has to do with just offering information and support for people who want to help people. All right, and when it comes to mental health or mental illness, one thing I want to urge people is to offer understanding. All right, so through that, it's very important that as a community that we take away the stigma associated with mental health or mental illness, because many times that stigma will hold people back from actually getting the help at an earlier time, as well as getting help at all. All right, so by offering, help and support to our own community members, they're more likely to come forward and be able to discuss, talk about, and get help. All right? If they're feeling that they're being judged in any way, we all do it. If we feel like being judged, we're not going to say anything. And that doesn't help anybody when it comes to mental issues and or mental illness. One of the things I wanted to focus on has to do with the fact that people don't choose to have a mental illness, and that mental illness is very much like physical illness. You wouldn't say to somebody, blame somebody for having, say, like heart issues or having a heart attack. You wouldn't blame them for that. So in the same mode, you wouldn't blame somebody for having depression or suffering from schizophrenia. And both these diseases or illnesses cause disability in our community. And we want people to be able to get help. We want to urge people that, it's okay, and that we all experience different levels of mental health at different times in their life. Right now, it's very high stress. We use different means of coping with the stress that has been going on for a very long time. That could include anything from suffering from depression, anxiety, as well as other latent type of mental illnesses could be brought forward because of the stress or because of substances. Substance abuse or substance abuse is also an illness, a mental illness as well. And we want to urge people that if they're using this type of coping mechanism, that there is help, and there are other healthier means of being able to feel a lot more comfortable with your mental health. there are healthier behaviors, you know, getting involved with people, talking. We might not be able to be together, but we can try to, you know, take walks, get outside, and ask for help if we're struggling. Those are really important, especially if you know, especially when we're talking about young people. One of the things that is affected by these stressful times, as well as the mental problems that are coming out, and we're finding that they're linked very closely, is suicide. One of the things with suicide is that, again, if internalized, I think I want to also just say that, you know, like when it comes to suicide, the suicide thoughts, the suicide behaviors, they're really quite normal, especially under duress and or stress. These things come up, they stick in our head, or they come into our head, but most of us will say, no, that's not a really good option. And when it starts to become an issue is when it starts to become more and more of a serious option, all right? And so with when people are experiencing mental stress, as well as suicidal thoughts, there are symptoms that will come forward. Mostly it has to do with the symptoms that could be recognized when you have a relationship with this person. That's why we want to urge people just to, you know, talk to one another, call people. If they're alone, you know, give them a call, talk to them, you know, invite them to, you know, a Zoom meeting, or, you know, just talk to them on the phone. Nowadays, if somebody is alone, you can also, you know, go and visit them and just try to find out how they are. Those are really important connections that support life-affirming messages to that person, letting them know that you care. And, you know, if you're unable to do that, we also have KSCS, as well as outside organizations. If you're not comfortable in talking to somebody at KSCS, that's okay. There are other resources in our area, and those are something that I wanted to talk a bit about. First of all, if you think somebody is possibly experiencing an overdose, all right? As we know, substance abuse becomes a coping mechanism, and that can cause its own problems in our community. I want to urge people that if you suspect somebody of having an overdose, that we do have a card available which has things to do if somebody is experiencing an overdose, and also the signs of an overdose, all right, and give you an idea. Also, afterwards, it will be listed on. I also have a lot of phone numbers for local resources that are available to community members. If you're not comfortable with talking to somebody one-on-one, which, as we know, a lot of our young people are more comfortable with texting, there are also texting numbers that are available. For example, I know that the Kids Help Phone, which is not just for kids, it should maybe be called the Youth Help Phone, but it's the Kids Help Phone, and it can be reached by calling or texting 686868. There is also other help available, and in particular, I want to highlight the number for the First Nations and Inuit Hope for Wellness. All right, that's a 24-hour, 365-day number that you can reach that is specifically for First Nations people. So you will feel more understood. And that's one of the things we want to say, is that when it comes to help, we want you to be comfortable enough to tell us what you need, as opposed to us telling what you need. Talk to us, let us know what's going on, and if anything, reach out and connect with people. That's the most important thing. And if you want to call me any time of day, I'm here, all right, as well as many people at KSCS, and also our prevention workers. So with that, I want to say thank you, Kahnawake, and please be safe and be happy. Thank you.
Kahnawake, Christine. Appreciate all of that helpful information. Up next, Don Montour-Lazare from the Cattery Memorial Hospital Center. Don?
Sego. So I'm coming today as part of the local public health team to discuss what's going on at the Step-by-Step Early Learning Center. So it was noted this week that there was an educator that is part of bubble of classes for classes 1, 2, and 9 that had tested positive for COVID. And the educator was last present January 28th. In our investigation, there were no children that were evaluated as close contacts of this case during the period in which she was contagious, so which is why we haven't really placed anybody in isolation up until now. As of today, because we received some additional related or unrelated information which we're still investigating, the local public health team has made a recommendation while waiting for further details. So as a precautionary measure, we will be closing rooms 1, 2, and 9 as of today to ensure that there's no further spread or transmission of the virus. Until we've received more information or directives, we ask parents and children in room 1, 2, and 9, as well as members of their households, to remain in isolation until further notice and monitor to help for any symptoms. Once we receive information within the next 48 to 72 hours, we will advise the families what they need to do with regards to continued isolation if needed. We will be calling everybody at that time. Remind you that this is just a precautionary measure. And what we're saying as well too is that this is something extra we're doing, because if we were following the guidelines that we have from the Montour-Lazare Public Health, we would actually be waiting until we got more information, that we got more positive tests in order to isolate everybody. But we realize that we want to make sure that everybody stays safe, so we're asking people to isolate now. So in the meantime, if you feel like you're developing any symptoms, please contact the KMHC testing site at 450-638-3930, extension 2275 or 2296. The symptoms that you need to look for are fever, general symptoms like sudden loss of taste or smell, major fatigue, loss of appetite, general muscle pain, usually without physical exertion. Respiratory symptoms like cough, which is new or worsening, shortness of breath, difficulty breathing, sore throat, congestion, runny nose or stuffy nose. Gastrointestinal symptoms like nausea, vomiting, diarrhea, or stomach aches. Symptoms can be mild or more severe, like those associated with pneumonia. Sometimes they're very, very minor, and like we're talking about very young children, so extreme fatigue could mean just like they're lazy, they're just lazing around, not their usual self. As parents, we know how our kids are, and if you find your kid is not really in their normal behavior, not as responsive, not eating as well, that might be the thing that might trigger you to think that something's going on with your child. Please rest assured that we are monitoring the situation closely in collaboration with our Montour-Lazare Public Health, and will communicate with you immediately as information becomes available. The health and well-being of our families remain our top priority. Nyawa for your collaboration, and onigiwahi.
Nyawa go Don. And finally, our last guest of the day is Lloyd Phillips, Commissioner of Public Safety, and he'll join us right now. Lloyd, you know.
Okay, thank you, Wahsontiio and Christine and Don for that information. Certainly a lot of information there for the community to digest. Certainly some positive developments, with the Kahnawake Youth Center doing a fantastic job trying to have a winter carnival, during these really tough times, and trying to think of unique and creative ways to have some family fun, but at the same time, respecting all the safety measures that are in place. I know it's not an easy job. We do communicate with them on a weekly basis, and it's a work in progress, and they're doing an excellent job. As well, thank you, Christine, for being here and giving some more information on the mental health and some of the services that are available, but as well as your perspectives on what can be done on an individual basis as well. And that's been one of the main things we've been talking about, throughout the past couple of weeks is mental health is key. On all our mediums that we've been speaking to the community, we've been really emphasizing that a lot, that there are services available, in the community, external to the community, but it's not always just, a service. It could be a companion, a friend, somebody you could confide in, that you could reach out to, and if you're feeling anxiety or stress, and or even having some suicidal thoughts, reaching out to somebody for that helping hand is really important during these trying times. And we've been saying over and over, at this point in time, or for the most part, any time, but even more so during the pandemic, it's okay not to feel okay. And if you're feeling like that, there are people available to assist you. And it's certainly turning now to with the developments, within Step by Step. And thank you, Dawn, for providing the information. I know she was very busy, along with Lisa this afternoon, gathering this information and putting it all together, and making sure that the parents are first and foremost aware of what the situation is. And then we also, again, in the spirit of transparency, making sure that the community is aware, what is happening. And it is with an abundance of precaution that the Kahnawake, our local public health team, has taken this step, again, because we want to be ahead of things. We want to make sure that we minimize any possible impact to the children, to the staff, and ultimately to the community. So once again, great job there. As I said this morning on K103, we can't expect not to have any more cases in the community. Way the virus has been spreading, from the first wave to the second wave, we're likely to have continued cases, over the next months. But we're trying our best to make sure it stays at a manageable level, where it stays as minimal as possible, so that we minimize the chances of major outbreaks in the community. We minimize the chances of having any major illness or death in the community. So that's what we really have to focus on, and remaining vigilant. Taking the measures seriously, and staying the course is what's going to help get us through this. Step by Step has been doing an awesome job, since last March, ensuring that the safety of the children is paramount, and this is just an extension of that to ensure that precaution is taken, so that we maintain a safe environment as possible. But keep in mind, it is a virus. A lot of things are unpredictable. And we have to change with the times, and we have to modify our approach as we go. And again, put in measures and directives, and take action such as closing some classes step by step, as required. But also we don't want to put measures in place again just for the sake of putting measures. We want to make sure that we're doing it with a logical thought process, and with information available in front of us, at the moment. As I mentioned, there's still information that has to be considered. More information will be forthcoming, and public health will definitely do their due diligence in informing all the appropriate people as the days go on. But right now, on another positive note, our numbers of positive active cases is at 4 in the community. Again, that's a number that we've been bouncing around for the past week or so. So let's just certainly be vigilant as a community and try to keep that number as low as possible. We certainly don't want to see things go back to the way they were earlier in January, where, again, I think certainly the task force and a lot of community members were getting concerned when they seen that trend going from 5 to 10 to 20 and on upward. We were successful at breaking that trend, and let's make sure we stick together to maintain that. Right now, the task force, after the recent directives were changed for visitation, allowing 1 visit per week in the home, effective January 29th, and the expiration of Directive 55, which closed a lot of retail and manufacturing in the community. Those are some of the major decisions that were recently made, so what we are basically task force wise is more in the maintenance mode at this point. Those 2 directives were changed, they did expire. So now we need time to continue to assess if there's any impacts from those directives before we consider next steps. We want to see the impacts of the most recent decisions that are made and that were made by the task force. Because I know a lot of people have been asking, saying, well, for example, while we're now allowed visitation in the home 1 per week, does that mean now we can go out and have outdoor activities with 2 families, and can we do this? And many different type of questions around that. And we want to make sure that we keep it clear that gatherings, indoor or outdoor, are still prohibited. There's a difference between a gathering in a home versus a visit, and there's a fine line there, but make sure we're talking truly about a visit here. And we don't want to say open up things too quickly. If we start allowing smaller gatherings and more collective activities outside the home, again, possibility of the spread of the virus is increased. If we were following the Quebec rules, there would not be no visitation allowed. But because of the uniqueness of our community and the area and the place we were in now, we felt comfortable taking that step and give it time for us to assess that moving forward. And in the weeks to come, we may look at additional measures if things remain at a manageable level, at a safe level. We'll certainly reconsider anything that we need to do. On a final note, just as a reminder, Quebec has extended the curfew for their citizens, and which is at 8 o'clock within our general area, which is part of the impacts our local retail businesses, those that were closed as a result of Directive 55. They will be required to also close their establishments at 7:30, so that we do not encourage Quebec citizens to break their curfew to come to the community. So that is still going to be a requirement until Quebec decides to remove the curfew for their citizens. So we have to do our part in that area to ensure that we don't jeopardize any of their citizens. We also do it in part to support the healthcare systems and as well as ensure that the Kahnawake acts in a manner that supports us, but also looks at the bigger picture as well. So with that, I'll leave it there. A lot of information for this afternoon, but take care, and I'll talk again soon. Kahnawake.
Lloyd. And just a reminder before we go, KMHC will have some drop-offs for the inpatients. So that's going to be this Sunday, February the 7th, on between 10 and 1. We also have a special one on Valentine's Day, February the 14th, and Sunday, February 21st. And those are between the hours of 10 in the morning, 1 p.m., and please, no refrigerated foods or any foods that need to be rewarmed. And that's it for today's program. We thank you very much for joining us here today. From all of us at the EOC, Nyawagoa Danu, Onagiwahi.